the principles of cancer prevention and its early detection. Regarding the biological nature of cancer, first, the study of cancer is regarded as part of the clinical medicine. The cancer cells are regarded as psychopathic cells because they behave in abnormal fashion, not similar to that of the normal cells of the body. The cancer cells have no respect for all the rights of the other cells by that they violate the democratic principles of the normal cellular organization. The proliferation of these cancer cells is usually out of the control of the body. Normally, the body will control the growth and division of its normal cells. In malignant cells, they are out of the control of the body for its division and proliferation. The ability of the cancer cells to spread is unbounded. Their inexorable, relentless progress will destroy first the tissue in which they proliferate and the host in which they will be found. So, the proliferation will lead to destruction of the tissue and host at the same time. In order for the malignant cell to have such an principled fashion, the cell have to acquire a number of characteristics before they become fully malignant. These characteristics are very important to determine the malignant transformation potential of the cells to become a malignant cells. Usually a normal cells with multiple chains, which is usually a mutation at the genetic level, will be changed into malignant cells. So there are many characteristics the cells should gain in order to become a malignant and behave in abnormal fashion. Usually, no one characteristic is sufficient for the malignant cell or for the abnormal cell to acquire before it becomes malignant. And not all the characteristic we will mention later is necessary for malignant cell transformation. These characteristics for malignant cells are shown in the following table. For the malignant cells to have a malignant characteristics, it should have the following criteria. For the malignant cell should have established an autonomous lineage, which means it will resist signals that inhibit the normal growth, and it will acquire independence from signal stimulating growth. This involves developing independence from the normal signals that control supply and demand. The healing of the wound is a physiological process. The cellular response is coordinated so that proliferation will occur when it is needed and cease what is no longer required. This is the normal phenomena for the growth and development of the normal cells. In cancer cells, the growth, division, and stop of the division when it is needed is out of control of the body. So the malignant cells will grow independence of the need of the body. The second criteria for the malignant cell transformation is that it will obtain immortality. It means that the cell will continue to divide for a limited number of division. For normal human cells, the number of division is between 40 to 60 division. After that, the division of the normal cell will stop. The limitation is imposed by the progressive shortening of the end of the chromosome that is responsible for the genetic information of the divided cell, and this is called the telomere, that occur each time in cell division. So this progressive shortening in the chromosome end will lead to a stop of division at a limited programmed number of division. The cancer cells can use the enzyme telomerase to rebuild the telomere at each cell division. So even with the progression of the cell division, there will no shortening of the chromosome end of the malignant cells. So the malignant cells will have unnumberable division count. So it will continue to divide for a limited rate. And this will give there the immortality. The third criteria is that the malignant cells will escape or evade apoptosis. Apoptosis is a form of programmed cell death. The death will occur as a result of external and internal event instructing the death of the cell. In malignant cells, its character will lead it to evade apoptosis. So there is no programmed death of the malignant cell during its growth. The other characteristic of malignant cell is that it will acquire angiogenic competence. A mass of tumor cell cannot, in the absence of blood supply, grow beyond a diameter of about 1 millimeter. Means without adequate blood supply to the growing mass, the tumor mass will never grow beyond this limited diameter, which is about 1 millimeter. This places a severe restriction on the capabilities of the tumor. It cannot grow much larger and it cannot spread widely within the body unless it will acquire a mean of getting blood supply from the adjacent structure. The malignant cells and the malignant cell mass have the ability to perform a new blood vessels that supply it with the blood from the adjacent structure. So it can grow to a larger size during its growth. The other criteria of the malignant cell is its ability to invade the adjacent structures. Cancer cells have no respect to the structure of the normal body tissue. They can invade the adjacent tissue structures and implant in different sites. Cancer cells acquire the ability to break the basement membrane and thus gain direct access to the blood and lymphatic vessels. Cancer cells use three mechanisms to facilitate infection. First, they cause rise in the interstitial pressure within the tissue. They secrete enzymes that dissolve extracellular matrix, and they acquire motility that help it to invade the adjacent structures. The other criteria of the malignant transformation of the malignant cell that it acquires the ability to disseminate and implant. Once the malignant cell gains entrance into the vascular or lymphatic system, it will be carried by the normal transportation system of the body to a faraway organs or tissue in which they become implanted, and it will become growing in that faraway sites, producing what is called the metastasis from the primary site. So the malignant cells will have the ability for dissemination and implantation in other secondary tissue. Other criteria of malignant cells is that evade detection and elimination by the body. Normally, any mutated cell will be regarded as an abnormal cell, and it will be a foreign for the body. So the immune system of a normal person will eliminate these abnormally mutated cells. However, the malignant cells will have some characteristic in which they can evade and escape from the immune system to detect it as an abnormal cells. And this is one of the most important phenomena in which the abnormal cells can grow within the body even when the immune system of this body initially is intact. The other criteria is genomic instability. It means that the malignant cells is a genetic ferment. Cells are dividing without a proper check and balance. The DNA is being copied and the proof readers have been retired and ignored. So mutations are arising all the times within the tumor, and some of these mutations, particularly those in the tumor suppressor gene, may have the ability to encourage the development and persistence of further mutation inside the dividing mutated cells. The other characteristic of the malignant transformation or the criteria of malignant transformation is severe communication to and from the environment. Providing a false information is a classical military strategy. Degrading the commands and control system of the enemy is an essential component of the modern warfare. Cancer cells almost certainly use these similar tricks in their battle for control over the host immune and other protective mechanisms. So the malignant cells will trying at all the times to give a false impression and false informations to the body defense mechanism in order to escape from the detection by these protective mechanisms, and it will can grow in spite of the finding of these protective mechanisms. These characteristics are very important for a cell to become a malignant cell. It is very important for the normal cell to become changed into a malignant cells, behave in a malignant fashion, and can produce a large size tumor mass. The characteristic of cancer cells arise as a result of mutations. Only very rarely a single mutation is sufficient to cause cancer. Usually, multiple mutations are needed to require a malignant behavior. So the mutation of the normal cells, gene mutation of the normal cell is very important for the developing or for change of normal cells to a malignant cells. The cancer is usually regarded as a clonal disease. Once a cell have arisen within all the mutation necessary to make it fully malignant cell, it, it is capable at that time of giving rise to an infinite number of identical cells. Each of these identical cells have a fully malignant criteria. So, if the tumor cell in the tumor mass coming from a single cell type, it will be a uniclonal cells, and that it will give to a cells of a similar malignant type and behavior. To less extent, some cancers may arise from more than one clone of the cells, and this is the polyclonal phenomenon, and it will give a different biological and functional properties of the malignant cells in the malignant tumor mass. These are many important characteristics of the malignant cells in a malignant mass. Now we have to talk about the causes of cancer. Both inheritance and environment are important factors for determination of whether or not an individual will develop cancer. So the sharing of inheritance in the presence of environment sufficient for the inheritance to cause malignancy is usually act in a synergism. 80% of tumors have environmental factors, and 20% have genetic inheritance. In 80% of the cases, environment alone is not sufficient to cause tumor unless there is genetic predisposition. So, inheritance and genetic factors occurring or acting in synergism with the environmental factors to cause a malignant disease within the body. So the causes of the cancer will be divided into inherited syndromes that are associated with cancer and into environmental causes of cancer, as will be mentioned later in the following tables. This table will show many inherited syndrome. It is mode of inheritance and the associated malignancies and abnormalities, the associated tumor and abnormalities, and the way of prevention of these cancers or tumors. First, we have the familial adenomatous polyposis and the Gardner syndrome. It is inherited as autosomal dominant mode of inheritance, and the associated tumors and abnormalities include colorectal cancer under the age of 25 years, papillary carcinoma of the thyroid gland, cancer of the ampulla of Vater, hepatoblastoma, primary brain tumor, osteoma of the jaw, and the congenital hypertrophy of the retinal pigmentation, pigmented epithelium. The strategies for prevention is by prophylactic pan-proctocollectomy in order to prevent the development of these malignancies and abnormalities. The second syndrome is hereditary non-polyposis colorectal cancer, which is also inherited as autosomal dominant fashion, and the abnormalities will include colorectal cancer, typically in the age between 40 and 50 years, endometrial tumor, stomach tumor, hepatobiliary abnormalities. The prevention is by surveillance, colonoscopies, polypectomies, and non-steroidal anti-inflammatory drug use may reduce the occurrence of these tumors. The other syndrome is Busch-Jaeger syndrome, which is inherited as autosomal dominant fashion, and the abnormalities will include bowel cancer, breast cancer, and freckles in the mouth. Surveillance, colonoscopy, and mammography are very important for early detection of the abnormalities of the breast and bowel, which facilitate early intervention to prevent a malignant transformation in this syndrome. The Cowden syndrome, which is inherited as autosomal dominant fashion, and it will include multiple hematomas of the skin, breast and mucous membrane, breast cancer, neuroendocrine tumor, endometrial cancer, and thyroid cancer. The prevention is by active surveillance for detection of this tumor at its early stage. Retinoblastoma, inherited as autosomal dominant, it will include retinoblastoma, panuloma, and osteosarcoma. The other syndrome is multiple endocrine neoplasia syndrome type 1, also inherited as autosomal dominant. It will include the following tumors: the parathyroid tumor, islet cell tumor, and pituitary tumors. Multiple endocrine neoplasia type 2 will include the medullary carcinoma of the thyroid, pheochromocytoma, and the parathyroid tumor. These are some of the inherited syndrome, and it is associated tumors, malignancies, and abnormalities that occur in the body. And there are many other syndromes with it is associated abnormalities, and these are found in tables. I will send it to you later on. Now, will we concentrate on the environmental causes of the cancer? There are many environmental factors that can lead to arising of malignant cells and malignant masses. First, we have the tobacco smoking. The tobacco smoking is usually associated with lung cancer and even cancer in the head and neck. The strategies for prevention and early diagnosis is by tobacco, pan smoking in public places, and punitive taxes on tobacco smoking. Alcohol is also one of the environmental factors which can lead to malignancy. Head and neck cancer may be produced as a result of prolonged alcohol ingestion. Esophageal cancer and hepatoma are a known sequelae of alcoholism. Ultraviolet exposure may be associated with melanoma and non-melanoma skin cancer. The prevention is by avoidance of excessive sun exposure and avoid sunbed. Ionizing radiation may produce leukemia, breast tumor, lymphoma, and thyroid cancer. Limited medical exposure to the absolute minimum safety precaution at nuclear facilities and monitor radiation workers are very important for the prevention of the tumor arising from the ionizing radiations. Viral infection may also be associated with many malignant and tumor diseases. Human papillomavirus is usually known to cause tumor of the cervix and the penis. Human immune deficiency virus is usually associated with Kaposi sarcoma, lymphoma, germ cell tumor, and anal cancer. Hepatitis B virus infection is known to be associated with hepatoma and hepatocellular carcinoma. And the prevention is by avoid contamination and get infection with any of these viruses. Other infection like bilharziosis may be associated with bladder cancer, and Helicobacter pylori infection may be associated with stomach cancer. The treatment of bilharziosis and the eradication therapy for Helicobacter pylori is very necessary to prevent the development of these bladder and stomach malignancies. Inhaled particles from the industries like asbestos and wood dust may be associated with mesothelioma, and paranasal sinus cancer. Protection of the workers from the inhaled dust and fibers are very important to prevent the development of these diseases. Chemical materials like environmental pollutants and chemical use in industries may be associated with angiosarcoma, bladder cancer, lung cancer, nasal cavity cancer, and all the sites of the body may be exposed to the risk of malignancy during the exposure to these environmental pollutants. Chemicals used in medicine may also produce cancer. For example, alkylating agent used in cytotoxic therapy may lead to leukemia, lymphoma, and lung cancer. Immune suppressive treatment may lead to Kaposi sarcoma. Stilbestrol may lead to adenocarcinoma of the vagina in a daughter of treated mother, and tamoxifen may lead to endometrial carcinoma. Fungal and plant toxins like aflatoxin is known to produce hepatoma if it is exposed for a long period of time. These are the most important environmental factors that may be associated with increase in the risk of tumor production or malignant transformation. So you have the hereditary factors, the genetic factors, in association with the environmental factors, which act in a synergism for production and increase the possibility of tumor and cancer in the body. Now, we will talk about the management of cancer. In general, the management of cancer is more important than the treatment of the cancer itself. The traditional approach to cancer concentrates on diagnosis and active treatment. This is a very limited view on one that, in the term of public health, may not have served society particularly well. It implies an attitude on the occurrence of the cancer that is to facilitate an assumption that once active treatment is completed, there is a little no more to be done. Prevention is usually forgotten in dealing with tumors, and the rehabilitation after treatment of tumor is usually ignored in multiple centers. So, the management of the cancer span the natural history of the disease and all humankind. Usually, the treatment is started by prevention, then screening of the tumor to get a diagnosis. After getting the diagnosis, staging is very important. Then the staging is followed by treatment. The treatment is followed by rehabilitation. in order to complete the treatment or management of the tumor. So initially there is a prevention followed by screening. After screening, the diagnosis to be made. Once the diagnosis of tumor is made, staging is very important before starting the treatment. And after treatment, the follow-up and rehabilitation are essential. And these steps in the management will have a multi-personal approach. Initially started by the individual itself, then the family is implied in the schedule of treatment, followed by community, the region in which the person or the patient who have the cancer, then the country, and finally it is or it will be the job of the World Health Organization to share in the treatment of the cancer. Screening of the tumor. The screening of the tumor is very important for the detection of the tumor at its early stage when it is still manageable or it is still curable by many modalities of the treatment. So, screening is very important to get a high successful treatment rate and to reduce both mortality and morbidity from the tumor and cancer itself. So, screening involves the detection of the disease in an asymptomatic population in order to improve outcome by early diagnosis. It follows that a successful screening program must achieve early diagnosis and that the disease in question has a better outcome when treated at early stage. The criteria of screening should involve first, the disease, second, the test used for screening, and the program of treatment. Regarding the disease, first, the disease should be recognizable at its early stage, and the treatment at an early stage of that disease is more effective than treatment at a later stage. Also, the disease should be very common, or at least it is common disease to warrant screening. For example, breast cancer is a common disease and regarded as a killing number one in a female, and it need or it warrant a screening for detection of the tumor at early stage. Regarding the test used for screening, first, the test should be sensitive and specific for detection of the tumor. Also, the test should be acceptable to the screened population. It should be safe and inexpensive to be accepted and affordable for the population. Regarding the program used for the screening, it should be adequate diagnostic facilities for those with a positive test, high quality treatment for screen detected disease to minimize mortality and morbidity, and should provide screening repeated at interval if the disease is of insidious onset. benefit of the screening must outweigh physical and psychological harm to the patient. These are the criteria for screening program. Screening is very important for any cancer in the body, for it is detection at early stage. Absolutely, detection of the tumor or cancer at early stage is usually associated with a good outcome in the treatment of the disease, whether it is surgical or non-surgical treatment. Regarding the diagnosis of cancer, only rarely cancer can be diagnosed confidently by made in the absence of tissue or pathological or cytological examination. Usually, the diagnosis of the cancer will involve history taking, examination, and investigation. The investigations are used for diagnosis of malignancy, will include laboratory investigations, the imaging technique, and the tissue diagnosis. The tissue diagnosis, it means we take either a tissue for pathological or cytological examination. If we take a piece of tissue for biopsy, this is a tissue biopsy. If we getting only cells from the tumor mass for the examination or pathological examination, it is regarded as a cytological examination for diagnosis of the cancer cells and its type. And there are many types of tissue examination for diagnosis of malignancy. We have either incisional biopsy, in which only a piece of tissue are taken from the tumor mass, and we will send it for histopathological examination. Or it is an excisional biopsy, means that we will completely excise the tumor mass and send it for histopathological examination. While cytological examination is usually taken by fine needle aspiration from the tumor mass, whether it is superficial mass or it is a deep internal mass. The fine needle aspiration cytology is a type of cytological examination for detection of the malignant behavior inside of the cells of the tumor mass. Staging is also very important after diagnosis of the tumor, and staging is the process whereby the extent of the disease is mapped out. Means that we will know the extent of the development of the disease, whether it is still localized, it is progressive, invading the leukoregional area, or it have a distant metastasis far away from the primary site of the tumor to other organs. For example, carcinoma of the breast may be in an early stage when it is small and it is localized to a specific area of the breast tissue, or it may extend into adjacent structure with advancing in the stage, like invasion of the chest wall muscle, invasion of the skin, or extending into the axillary lymph nodes. Or it may get more extended staging by metastasis to the liver, to the spinal vertebrae, or into the lung and the brain. This is regarding the staging of the disease. And each cancer has it is a specific staging profile. Usually, the management of patients with cancer or management of patients with any type of tumor in the body should be done not only by a one person. It should be done by a team, by many members of multi-professional teams in order to get the optimum and maximum benefit from our treatment. So the members of the multi-professional team will include first a site special surgeon who is specialized in a tumor of certain area. For example, a surgeon who concentrate on the cancer of the thyroid gland, or a surgeon who concentrate on cancer of the breast, or a surgeon who concentrate on cancer of the stomach. The second member is the surgical oncologist, a surgeon who have specialty for oncology alone. The third member is plastic and reconstructive surgeon. This is the person who is responsible for correction of the deformities that occur after excision of the cancer, whether it is in the breast, in the thyroid, or cancers of the limbs. Clinical oncologists and radiotherapists are also part of the team. Medical oncologist, diagnostic radiologist, and pathologist are part of the team that are responsible for management of cancer in any part of the body. Speech therapists and psychotherapists are very important, especially for those patients who have cancer in the upper airway that may lead to difficulty in speech, and psychotherapists to avoid the development of psychological insult to the patient after major surgeries. Prostate test is very important, especially in limb cancer surgery. And clinical nurse specialist for rehabilitation and supportive care. Palliative care nurse is very important for symptom control and palliation, especially when the tumor is associated with severe pain, either in a pre or in a post-operative period. A palliative care nurse is very necessary to control these symptoms and palliate the onset of pain. Social worker.
بس دكتور العفو.
شلون عيني؟
عندنا محاضرة هسه بدت.
هسه بدت يعني خلصت محاضرتي؟
ايه هو لحد 10 محاضرة الجراحة وبال10 ناخذ غير محاضرة.
يلا ماشي تمام. البقية يعني من أكملها أدز لكم إياها زين. أريد الرقم مالتك
تمام
إذا
دكتور.
أمكن علي.